Individuals with Fanconi anemia have a 500 to 700-fold higher risk of developing oral cancer. Visible changes on the tongue and gums may be noticeable, while other areas of the oral mucosa, the lining that covers the whole mouth, may also be affected. It's very important to monitor patients with Fanconi anemia for any spots or lesions that develop in their mouths. Many of these spots are harmless, but Fanconi anemia patients have a very high chance of developing oral cancer, so it's crucial to catch these spots before they become cancerous. This video shows a step-by-step approach of an oral screening procedure for Fanconi anemia patients using painless brush biopsies. Brush biopsies are much less invasive than traditional incision biopsies and have been proven to be highly accurate at detecting pre-cancer and cancer. If the brush biopsy shows abnormal results, a traditional incision biopsy should be performed to confirm the diagnosis. The screening of the oral cavity consists of 3 parts: inspection, documentation, and brush biopsy. When inspecting the oral cavity, it's important to be systematic. No area of the oral cavity should be overlooked. If a spot or lesion is detected, make note of the following: the surface texture of the lesion, the color of the lesion, does the lesion hurt, and does the lesion start to bleed when touched? Any detected lesions should be documented immediately by taking photographs and by using a mouth map diagram. Changes to any spots are best assessed by taking photos of a spot over time. You can use your cell phone or any high-quality camera. The second part of documentation is recording any changes in writing on an oral map diagram. This will help you record visible changes by noting their exact position on the oral map. This is helpful because lesions are better tracked by referencing accurate photos and notes over time, especially if there are multiple lesions. If a traditional incisional biopsy is necessary after the brush biopsy, the exact site can be determined by referencing the oral map. And the mouth map helps patients share information on the development and changes of spots with medical professionals. In Fanconi anemia patients, all visible lesions or spots should be brushed using the brush biopsy procedure. It's not necessary to brush the normal oral mucosa, just lesions. Every lesion can be brushed with one brush, but it's highly recommended that 2 separate brushes are used in a row to obtain enough cells. The procedure requires that the head of each brush is pressed onto the lesion and rotated around its own axis 15 times. The direction of rotation should be maintained throughout the rotation period. If the direction of rotation is changed, there's a risk of losing the cells already picked up by the brush. If there is slight bleeding during the brushing, don't be alarmed. You can continue brushing. The bleeding usually stops quickly or, if necessary, may be stopped by compression. After the rotational brushing, the brushes are placed in a transport container. If 2 brushes were used, they should be rubbed against each other in the container. If only 1 brush was used, it should be rubbed against the inner wall of the container. Next, the brushes are separated from their holder at the demarcated area along the shaft. The container is then closed and labeled according to the marked lesion on the mouth map. Finally, the container should be shaken lightly to disperse cells in the liquid. Now the cell samples can be sent to the lab for cytopathological examination. It's advisable to select an oral diagnostic laboratory that's experienced in analyzing samples from Fanconi-Anemia patients. The samples can be sent by regular mail at room temperature. All information on the screening can be found on our website. This includes detailed descriptions of the brush biopsy screening procedure, downloadable mouth map, brush biopsy kit purchase information, and contact details for the cytopathological investigation.